Hi Heather, thanks for coming in today. My name's Stephanie, I'm a registered nurse. What brings you in today?
I've been diagnosed with POCS, which I think stands for polycystic ovarian syndrome.
This is a hormonal disease that causes irregular periods or excess androgen levels. So what are your feelings towards this condition? Do you have any concerns?
Well, now that I am pregnant, I worried that it might affect my breastfeeding or my ability to breastfeed. I don't know what I can do to help me.
I hear that you're worried, but I am here to help and talk to you about your options. Research has actually shown that PCOS is not recognized as a factor that could potentially influence your breastfeeding ability. First, I would like to start by talking to you about the signs and symptoms of PCOS. So tell me about what kind of symptoms you've experienced.
Longest time I was having irregular periods. I didn't think anything of it until I wanted to have kids. Then I finally went to my doctor and I was diagnosed with PCOS. Yeah. My doctor did some tests and I have high excess amounts of androgen, which I guess is some hormone.
A diagnosis of PCOS is usually occur when you have at least two of the symptoms. So in your case, irregular periods and elevated androgen levels. Research has shown that the high levels of androgen can downregulate both estrogen and prolactin receptors. Progesterone helps with breast development, while estrogen and prolactin help with initiating and maintaining milk production.
So what should I be doing to achieve my goal of breastfeeding?
For this appointment, I'm going to be teaching you about how to maximize your milk production when you are going to breastfeed. And this is something that you will be able to do when your baby is born and will help you produce more milk to support your baby. Two things that I want to talk to you about are going to help promote your milk production are skin-to-skin contact and breast drainage. Skin-to-skin contact is having your baby on your chest with no clothing in between you and your baby. So I have this doll with me, and if it's okay with you, I'd like to practice skin-to-skin contact with you in this doll.
Yeah, I would like that.
Okay, so I'm just going to help you place the baby onto your chest. Is that okay?
Yes.
Here we go. So if you notice, the infant's body is going to be directly placed on your chest. You want the baby's stomach to be against your chest so you're not putting any strain on the baby's neck. It is also important to find a peaceful area to breastfeed, as studies have shown that stress can have a negative effect on your milk ejection. The next thing I want to talk to you about is the breast drainage. Studies have shown that milk synthesis is increased by increasing your breast drainage. This can be done by hand expression or pumping. Hand expression has a lot of advantages, such as zero cost, can trigger more effective milk ejection reflex, and is also always available. Now I'm going to talk you through how to hand express. I'm going to direct you to this pictogram to follow along the pictures, and I'm going to narrate what we have to do. So in A, this is when you wash your hands, you collect your materials, you sit in a comfortable position, and apply any moist or warm towels to enhance your milk flow. You can massage the breast and the nipples and stimulate for milk ejection reflex. In the B photo, we are going to squeeze the breast gently, rolling the hands forward from the chest towards the nipple. In C, we're going to place the thumb and the forefingers approximately 2 to 3 centimeters behind the nipple and press into the breast. For our D, we're going to press inward toward the chest while squeezing gently with a slight rolling action towards the nipple. Release pressure and repeat if needed. And in our E picture, we can change position of the fingers around the areola to express milk from any of the ducts as possible.
Thank you for teaching me. I'll definitely practice that.
Perfect. I'm also going to provide you with this pamphlet that outlines everything that we've just discussed with the skin-to-skin contact and the milk expression. You can take this home just as a reminder, but you can also contact me if you have any questions. Thank you for coming in today, and you're welcome to call me or my office at any point if you have any questions.
Thank you for having me. It was very helpful.